Hi, Preceptor Christy. I'm going to tell you about this guy that is in our clinic today. His name is Arun Patel, and he's a 38-year-old Indian American male with a history of type 2 diabetes, generalized anxiety disorder, hypertension, and he's coming in for a checkup. He states he's been not monitoring his blood pressure or glucose regularly at home, but he does have a glucometer. He just doesn't like to the needle part of it. He's under financial stress, which contributes to his health issues. He has gained approximately 15 pounds in the past 3 months. He reports feeling fatigued with generalized discomfort for the past 3 months also. He has endorsed increased thirst and urination for the past month. He stated he's taking his medication as prescribed and he never misses a dose. He reports having a sedentary lifestyle, does not regularly exercise, and the way he relieves his stress is he eats takeout food, but does not binge eat. His allergies, he doesn't have any allergies to the environment, latex foods, or medications that he knows of. His home medications, escitalopram, 20 milligrams PO/Q day for anxiety. He is on hydrochlorothiazide, 50 milligrams PO/Q day for hypertension. He is on metformin, 500 milligrams PO/BID for type 2 diabetes. So he has generalized anxiety disorder, hypertension, and type 2 diabetes. He has no past hospitalizations or surgical histories at all. His mother has hyperlipidemia and type 2 diabetes. His father has hypertension, and his parents are both living and well. Social history, he's a graduate student. He just moved in with his girlfriend. He, like I said, frequently eats takeout, but denies binge eating. He denies exercise, admits to having a sedentary lifestyle, no tobacco, nicotine, alcohol, or recreational drugs. His immunizations are up to date. His review of systems, he is constitutionally, he has no weakness, complaints of fatigue, denies fever or night sweats. He denies eye pain, pressure, or visual disturbances. His ears, he has no pain, no hearing disturbances, tinnitus or discharge. Nose, no congestion or discharge, bleeding or pain. Mouth and throat, denied cough, pain, or sore throat. No swelling in his glands. His respiratory status, he denies shortness of breath, coughing, or wheezing. Cardiac, denies chest discomfort, palpitations, or dizziness. GI, denies nausea, vomiting, diarrhea, no abdominal pain, cramping, or discomfort, denies any change in bowel habits, states that he is regular. Musculoskeletal, he denies joint pain or stiffness, denies muscle pain, hematologic, no bleeding or bruising. Skin, no rashes, redness, or irritation. Neurology, no complaints of headaches, numbness, tingling, dizziness, lightheadedness, tremors, or involuntary movements. Mental health, he denies depression, but has a history of generalized anxiety, which he is on medication for. He is 5'9", 233 pounds. He does not have a fever. His blood pressure today is 146/94, heart rate 75, and his saturation is 98%. Glucose level 6 months ago was 142. It was fasting. A1C 7.5. His glucose 1 week ago was 210. A1C 9.3. Glucose home monitoring randomly 4 weeks ago was 218. 2 weeks ago was 220. So that looks like it's going up. His blood pressure at home 4 weeks ago was 142/96. 2 weeks ago was 144/92. So that's going up as well. Physical exam, head and scalp are normal. Hair distribution is normal. Extraocular movements intact. Pupils equal, round, reactive to light. Lids without redness or swelling. Ears, no erythema or effusion. Nose, no erythema or swelling. No discharge, no postnasal drip. Throat and mouth, no nodules or tonsillar, cervical, or any lymph nodes noticeable in the neck. chest and thorax, no cough, clear sounds in all fields, breathing bilaterally, no use of accessory muscles, no pain related to respirations. Cardiovascularly, he has an S1, S2, 2+ pulses in all 4 extremities, capillary refill less than 2 seconds. Abdomen is soft, non-distended, bowel sounds present in all 4 quadrants, no masses noted. GU, no redness, swelling, or discharge. Musculoskeletal, full range of motion, steady gait, and balance, no weakness noted. Neuro, he is intact, alert and oriented ×3, pupils equal, round, reactive to light and accommodating, cranial nerves intact, no tremors, DTRs 2+, and equal bilaterally. Psychology, he has a neat appearance, he's well dressed, behavior and speech appropriate, mood and affect normal, patient cooperative, and able to answer questions. My assessment, this is a 38-year-old Indian American male who presented to the clinic for a checkup. He has not been checking his blood sugar and blood pressure at home. He's under financial stress from being a student, which is contributing to his health issues, gained 15 pounds in the last 3 months. He reports fatigue, generalized discomfort for the past 3 months, as well as increased thirst and urination. Diagnosis, general anxiety disorder, hypertension, type 2 diabetes. The plan is to increase his medication as follows. Lisinopril, I think that we should add, give him lisinopril hydrochlorothiazide 10 milligrams and 12.5 PO/Q day for hypertension, and add glipizide and metformin 2.5 and 500 PO BID for type 2 diabetes. Education for this guy. Mr. Patel has a significant decline in his history due to his diabetes, diet, and sedentary lifestyle. I'm going to refer him to a dietitian for dietary interventions and intensive diet education. I'll also make a referral to social work for his financial concerns. Teaching was completed for medication, including medication with meals to avoid GI upset, take it at the same time every day, discontinue previous medications, signs of lactic acidosis to report to us, such as abdominal, stomach pain, fast and shallow breathing, signs of low blood sugar, for the lisinopril, to avoid and seek emergency help if you show signs of allergic reaction, and call your provider if you experience any signs of low blood pressure or angioedema. And he understands all of that. So that is my presentation of Mr. Patel.